Welcome, everyone, and thank you for joining us this evening with Barbara's Bookstore. We're very excited to discuss Dr. Nicole Williams' first ever book, This Is How You Vagina, all about your vajayjay and why you probably shouldn't call it that. This is such a wonderful, honest read about the medical history, science, and myths about vagina health, but also touches on some thought-provoking ideas such as vaginalism, which explores our vaginas from a race and culture perspective. So let's get this started. Dr. Williams, thank you for joining us today. Tell us a little bit about yourself. What made you decide to become a gynecologist, and what made you decide to write a book about vaginas?
Good question. Thanks, everybody, for coming. Please use the chat. Ask questions. We're more than happy to kind of bounce things off. So again, I'm Dr. Nicole Williams. I'm originally from East St. Louis, Illinois, downstate Illinois. So go Cardinals. Sorry, how to say it. I grew up like cutting open to my mother's great chagrin, my stuffed animals, because I wanted to see what was inside of them. I wanted to see how they worked. You know, I was a little kid. You realize there's nothing in there. There's no organs. It's just stuffing. But it took a while. And it was just that fascination with how the body worked. That's what kind of guided me toward medicine innately. Like it was like written on the stars. But what guided me to gynecology was the female friendliness aspect of it. So I'm growing up grammar school and whatnot in the late 80s through the 90s for high school and undergraduate. So I'm in medical school late 90s, early 2000s. And even though it's supposed to be better then, it wasn't for women. And I was a little sexually harassed on my medicine rotation. There was this one particular resident would say, "Oh, have a look at the beautiful Dr. Williams right there. Just keep looking at her. Isn't she beautiful?" I'm a medical student. And so that was, and it was subtle, but still, you know, that you don't forget those things. You don't forget how you feel. And like, why would I want to be a part of that? Then I really enjoyed surgery, you know, hence with the stuffed animals, but I had a bit of an experience on the surgical rotation, not about me, but about another very beautiful resident, Black woman who was, I overheard some colleagues talking about her anatomy, mainly her bottom, that it was really beautiful and the things they would love to do to it. And I knew that wasn't my place either, because I know me, I would have walked up to him and sucked him in the eyeball if he were talking about me. And I wouldn't have a career. I certainly would be sitting here talking to you about vagina book. So that's when I did the rotation on OB-GYN, it was just so welcoming to women. There were men there, but they were like your uncle, you know, like pull my finger kind of guys who really genuinely wanted the best for their female patients. And I felt so welcome, and it was so female centered and female goddess friendly that I said, you know what, this is my spot.
Right. I love that. So kind of touching on some of the things that you just talked about, and this is how you vagina, you discuss vaginalism and you kind of dive into the history of vaginas, especially within race and culture. I'd love to read a few sentences that I found incredibly profound and have you expand on them if you don't mind.
Okay.
So everyone, if you have a copy, this is in chapter 15 towards the end of This Is How You Vagina on page 236. So she writes, "As an African-American woman, I am acutely aware that my vagina and myself are perceived as different from other owners of vaginas. My vagina is angry. It's an overtly sexual place, not a sacred one. My vagina is hidden, hungry, deviant, voracious, dangerous, delinquent, domineering, and must be tamed, much like my very self." That's heavy. And for the content, so beautifully written. Tell us a little bit about that.
This, for me, I didn't intend to write this chapter, Christine. I did not.
Really?
No. I just wanted to keep it like a little fun vagina book. Let's throw in some jokes. and let's empower vaginas. But I said I would be absolutely remiss if I did not, it's the elephant in the room. I can't be a Black woman and write this book and have a vagina and not talk about that other part of me that is so central, and why I believe that Black women have been castigated and put aside and seen as angry. And it really, I was just sitting, I didn't, like I said, I just kind of started like, oh, well, let me see if I can just put this in another chapter. And once I started writing, I couldn't stop. I guess the lit major finally came out in me. And all those words, I had to use all my words. And for me, it was important to say, because I have seen how I compare as a woman to other women who might be very, very similar. Put it this way. I had a white boyfriend when I was in medical school, and we were great. We had a good time. It was wonderful. Then it started to get to that point where it's like, okay.
Yeah.
I went to meet his parents, and their two are white. You know, that happened. And then after that, it kind of had to go away because I was not seen as somebody, even though I'm a doctor. Right. I'm a nice person. I'm easy on the eyeballs. But it didn't matter. I could be well-spoken, beautiful, skinny. All of these things are supposed to like check these mythical boxes for the ideal woman, but it doesn't matter because I didn't check that particular box. And then what really, it made me realize that this boyfriend of mine, who will remain unnamed for, you know, we're protecting the innocent. I'm trying to be nice. Don't go track him down or anything. Slash his tires. But I realized that he was with me for the thrill of it. Wow. There's no thrill. I'm just female. Right. John was like I said, like aside from this few little medical differences, I said the few actual medical differences between vaginas, which isn't a whole lot. I did find some research on it, but it's the same vagina. It doesn't really matter. Yeah. It was that. And that I really wanted to speak to that, not for the male component. I want my white vagina owners. I want my Latinx vagina owners, my Asian vagina owners, my mixed vagina owners, all of my vagina owner sisterhood to understand how we're all perceived differently, not just Black vagina owners, but we talk about way earlier in the book how white women in the Victorian age were seen as demure. You had to like coax sex out of them. They were frigid. They were shy. They didn't want to do it. It was like, oh, you had to do all this stuff to get them to have some sex. And that came from Freud, who, God, I wish he could have been burned at the stake before he got a chance to write anything. That I didn't, you notice I didn't really write that much about him in the book, and I did that on purpose. I did not want to. He doesn't deserve the attention. Nope. He has like 2 footnotes in the whole 300 pages. It's not, okay, don't be afraid. It's not, it's mostly notes that's the end of the book. So this is the book, this is the notes. So you guys can read the whole thing. But I want us all to understand these differences, because when we understand how we ourselves are treating each other, then we can get better. Yeah, and that's a perfect segue into my next question. In the book, you dispel many common myths and misinformation concerning female genitalia. And I would love to know what some of the most common myths or misconceptions are that you found the most shocking. But you said a word while you were talking about when you were speaking before, the word frigid, and the term frigidity was an actual medical terminology for women who essentially tightened up, basically too tight in order to have sex. So penetration wasn't possible. Right. A medical term. It blew my mind. I can't.
anyway.
Yeah. Yeah, that medical term is terrible. And so we now call it really what it is. It's called pelvic floor dysfunction.
Right.
The muscles of the vagina do tense up. And we don't always know why that is, but we have different treatment algorithms for it, which we do talk about in the book. I do individualize it for each of my patients too, because we might want to try one thing. We might actually want to try the CBD. Who knows? But I want to individualize it for each patient because there is a reason behind why you're clenching, and we want to kind of get to the heart of that too.
Exactly. So were there any other myths or misconceptions that, you know, kind of stood out to you when you were doing research or?
The man eater. I mean, it didn't shock me, but what was most interesting is how I saw vagina dentata. They mean like, you know, this is the vagina, right?
Right.
I saw this myth pop up in so many different cultures. I was like, look, this is hundreds of years difference, different continents. Yet there was Maui in Hawaii, who's a demigod. Then there's in the Indian culture. And of course, we have that all the way up to, what is that? Is it Hall & Oates? She's a man eater.
Oh, yes.
Because our vaginas are this place that actually emasculates the men because we actually eat them up. And also, if here's another little interesting tidbit. I'm telling you all the tidbits in the book, but still buy the book because it's actually fun. The word semen, it's food. And when a man loses his semen, they think that he's having a little death, like he's actually dying a little bit because it's in the woman and the woman eats the food of the semen.
That's what they call orgasm in France, le petit mort.
They call it le petit mort. Oui.
Yeah. Oh man, I love that. It's funny though. So you have several chapters on the different types of vaginas in the book. You have the bloody vagina, birthing, menopausal, orgasming vagina, and the rejuvenated vagina. And I was telling you that I grew up surrounded by women. So talking about periods and menopause, you know, within reason was pretty much dinner conversation for us. But I also know it's really uncommon. And as we go through these different life stages, our vagina, it's not always the same, for lack of better words, but many women don't realize it until they're in the thick of experiencing these changes. So how did you decide to write a chapter for these particular types? And what are a few things that women don't know about in regards to how the vagina evolves over time?
The reason I wanted to write about the different types of vaginas is that I wanted people my vagina owning sisterhood, to understand kind of the broad strokes of all vagina. Now, this is not a comprehensive volume, but these are the most common things. So we're all going to bleed. Okay, so we got to talk about bloody vaginas. But then I also want to talk about some of my patients' more common questions and the themes that they would always bring to me, like my vagina's itchy, my vagina's burning. There's something on my vagina. I took the hair off my vagina and now there's something wrong with it because I looked at it entirely too close. And sometimes you should just leave it alone sometimes. Talk about that. Then I also wanted to kind of bring it into the next phase. Some women give birth, some women don't. I did want to touch on that so that we understand the expansion and the contraction of the vagina and how absolutely freaking cool that is. It's not just our bellies that expand and go down. The vagina actually expands to 5 or 6 times its size. It goes from something like this to let out a baby head like this.
Yes.
And then it goes back. And it really does go back. It might take several months, a little exercise, but generally your vagina was made for this. I wanted you to understand that your vagina is made to go through these things, even the menopausal vagina. And I wanted to really emphasize the role of bacteria. I talk about bacteria from chapter 2 all the way through most of the book. So I want you to understand healthy gut, healthy vagina, healthy gut. And a lot of my patients want to eat poorly And then they go, oh, my vagina is unhappy. And I go, yes, she is, because she's not well hydrated. You can't have Diet Coke and coffee and have your vagina be okay with life. So I talk about diet, I talk about lifestyle choices, and of course I do talk about menopause. I'm happy that I'm alive in this time that women are talking a little bit more about menopause, but I wanted to talk about menopause from a vagina perspective. Everybody talks about hot flashes and mood swings and all of those other annoyances from menopause, but I wanted to talk about, sorry, I live right down, with the horns in the background, sorry. I wanted us to talk about what we can do for a vagina in menopause. And then sometimes it's actually nothing. If you're having regular sex, if you're hydrated, yes, the bacteria is going to change, but is that a bad thing? And I want to emphasize to my patients that the answer is actually no. It's not a bad thing. It's an evolution.
Right. It's an evolution. I love that. We have a couple of questions, so I'm going to ask one of them. So Angel, I think, what is the cause of pelvic floor and incontinence issues? Why isn't there more attention paid to it? And what is your approach?
So incontinence and pelvic floor issues can be, I call it multifactorial. It can be from weight gain, lifestyle changes, chronic constipation, and childbirth. So those are the kind of the big ones, especially for leakage of urine. It depends on how long you were in labor. So no, you don't want to have a long protracted labor. Sometimes that can't be helped. And you want to try to have a small baby. And something like, you can't have how do you control how to have a small baby? Eat just enough for yourself. The baby will take exactly what it needs from you. And I have a lot of my patients that they gain 60 pounds during pregnancy. I want us to kind of change that paradigm. You want to have 5-6 pound baby. Your vagina will go, done. Got it.
So much easier.
Easy. Let's have another. But when we have 8-pound baby, 9-pound baby, she'll be okay. But I think we kind of take her to the limit of what she's really meant to do. So that's one thing we can do. Now, how I approach that generally is pelvic floor physical therapy. I talk about that, and it has some really good study. A lot of people discount the use of these therapists. They're amazing women. And it's generally a female-centered. You're not going to find the guy who's working for the Chicago Bears become a pelvic floor physical therapist. He's going to work on knees and whatever it is with the football players, your throwing arm or whatever. But these are primarily women, and they work with you to strengthen and to be able to control these muscles, which is so important, because I've had patients after they've had a baby and unfortunately they split and we have to sew them up. Even though we try to just approximate it just like this, sometimes the muscles heal too tight. And that can actually cause painful sex. And what we do for those patients is I actually send them to pelvic floor physical therapists. In fact, in France, sorry, I'm a Francophile. I think you kind of are too.
Me too. Was that obvious?
Oh yeah, bien sûr, for sure. They get pelvic floor physical therapy after childbirth. Vive la France.
Oh, what a concept.
Yeah, and I don't do OB, but I have my patients who do come back to me after they've had babies. I go, can you do a little physical therapy? Just do 5 sessions, 6 sessions after every birth. That's going to help. If your lifestyle has changed, if you gained a bunch of weight, if you've been constipating, you're straining, those are things that we can change to improve our pelvic floors overall.
Got it. My best friend, she just had a baby this summer, and through her pregnancy, we kind of got into all these different rabbit holes about birthing, the body changing during pregnancy. And one of the things that we both found really interesting was that labor isn't meant to be like naturally is not meant to be done on the back. And that was done by male physicians.
Yep.
It's such a common thing to the point where, you know, her doula was telling her, you know, like if they force you to be on your back, you can request not to have the baby on your back if you don't want to. And it's just, this is something that so many women don't know. They just listen to what they're told and they just have the baby how they're told, but it's squatting is okay. Using a bar is okay.
Yes, is the best because it opens up the pelvis the most. Actually, squatting and pooping. I mean, squatting for, I hate to say, for birthing and for pooping, squatting is really the best. If you've been to Southeast Asia, you've been to the toilets, they're a squat toilet. And I've done it, gross, but it was the easiest poop.
It was the easiest poop.
And I know that, look, I'm United States trained, and we try to have our patients kind of sit up a little bit when they're having their babies. But then if you get an epidural, you can't squat.
Oh, right.
Because you don't have any leg strength. So it's much more difficult to really do it as naturally as you can because you want the pain management, and the best pain management is an epidural. But nowadays, just so you know, we are actually looking at nitrous oxide, laughing gas, for labor pain. And it actually works really, really great. It's very short term and it calms it down right away. And then you can set it down when you don't need it and it's out of your system. So wow. I think that paradigm is changing too. Let's hope so.
Yes, let's hope so. We have another question from Mary. She said, why is steaming not good? It's so calming.
Ah, Mary, I really hope you haven't steamed. Steam is for vegetables, it's for broccoli. Only way I'll eat broccoli, man. Okay, anyway, sorry. No bad mouth than broccoli. But the reason you don't want to steam is because it is useless at best because it hasn't been clinically proven to get into your bloodstream. So you can't squat over a pot of herbs and mugwort and peppermint or whatever they put in there. And that cannot possibly get into your bloodstream to regulate your hormones. Now, it might feel nice and that's okay. But I don't want my patients to pay money to somebody who is purporting to say that this particular mix of herbs is going to decrease your menstrual cramps, because it's not. That's why. And then at worst, it could burn you. If you're with somebody who's a brand new squatty steam person, what if the water's too hot? What if you're sitting on there too long? You fall asleep, whatever. We just don't want anything that's not necessary for our vaginas. If you do want to do something in place of that, then maybe add a few drops of essential oil into a bath. That's perfectly fine. I would use a little tea tree oil. I actually talk about tea tree oil and yeast infections in the book. It actually does have some data. So if that irritation is kind of bothering you, go with the stuff with the science. Don't give somebody $40 for, you can get a little thing of tea tree oil for like $6 off of Amazon. Put like 3 drops, 4 drops in your bath, a mild bath, not too hot. Relax in there. It actually smells really nice. It's a nice herbally cleansing smell. Do something like that before you would pay somebody for the steams. And that's why I just don't want people to spend money on stuff that we know isn't really going to do you any good.
Right.
Oh yeah, thank you, Angela. It's a self-cleaning oven.
Self-cleaning oven. Where did that first come from? I feel like I heard it on the Rachel Ray show or something a few years ago.
I have no idea where it came from either, because I was wondering about that myself, because I've heard it and I myself started to use it, but I don't know exactly where the self-cleaning oven came from. But I like that idea because I want us to understand that our vaginas, if we are healthy, we're eating clean, and we're not kind of overusing products and we're not preening her all the time, then she's going to be okay. And she might have a little smell, and that's your signature scent. we talk about that signature scent, which actually changes throughout a lifetime as our bacteria change.
That makes sense. This is perfect conversation with a timely topic going around the world with celebrities who shower.
Oh God, like, okay, you know, you could still like hit some areas though, right? Gotta hit the areas. Oh my goodness. Okay.
So Rebecca's asking what causes an itchy vagina.
I just had 2 itchy vagina patients just today. Thanks for watching at work, Angela. But I had 2 itchy vagina patients today, and both of them swore they had yeast infections. And after I looked, it was fine. So the first one, I think she says she did have one several weeks ago, a month ago or something like that. But I think she got herself into an itch scratch cycle. Now, what is that? If it's itchy, you scratch it, and then you're going to scratch it because it's already itchy. And you keep rubbing it, and then it makes it more irritated. And then you want to scratch it some more. That is one that's actually a little bit more common than we think. Because we go, you kind of do a little itch. You go, I'm going to leave it alone. I'm going to leave it alone. And then you go, oh, I can't help it. That is an itch scratch cycle. Usually I'll use like a mild cortisone or even a cold pack, because that can actually help to down regulate those kind of that irritated skin, calm the skin, calm the nerves. Other things that can cause an itchy vagina, yes, yeast can. Other things we're talking about, I don't want to talk about that one. HSV can cause, that's herpes, that can cause itches. Crabs can cause itches. There's so many things that can cause, if you shave and you have very curly hair and it's starting to come back, that'll make an itch. I do want my patients though to understand that if it's a little bit like this and it goes away, probably fine. You know, if you live with a man, like he just does his thing, he's like, oh, and he moves his balls around and he's just whatever. But if we do, we are programmed to believe that any small little itch is, oh my God, it's the end of the world. And I want us to understand that, you know, I just did like this with my nose. My nose was itchy. I mean, I don't have cancer. My nose was itchy. It was a little irritated. And then you go, okay, she's all right though. Drink some water, eat clean. She's going to reward you for it.
So that's one, you know, we were talking about how you cover a lot of questions that can make people so uncomfortable. They will even avoid asking their own doctors. So things like itching, things like burning, discharge, if there's a smell, but you've heard it all before. So let's talk a little bit more about it and, you know, break the ice, if you will. What are some of the most common complaints that you get from patients? Anything in particular?
I have a lot of my patients who believe that they have a smell. And it really, really bothers them. And some of them are just quite despondent about the smell that they have. And it takes me sometimes several visits to go through, and I go, okay, so we run through the panel of all the things where it could be. We check out and there's no disease whatsoever. And they go, well, I still have a smell. And then we talk about diet. We talk about eating clean, having a healthy gut, because the healthy bacteria in the gut can help the healthy bacteria in the vagina. So we talk about these things. And then we also talk about what's normal, because sometimes that scent is actually normal. It might have a little twang to it, maybe like a sourdough. Because you might have a little yeast in there too, which is normal to have. About 65-70% of women do have a few buds of yeast, not active yeast, just a few in there. And that's just kind of part of your personal bacterial stew. And that smell might change. I've had patients who take a new lover and they go, oh I have a smell now. And I'm like, well, you're now mixing body chemistry. And whatever bacteria he has, or she has for that matter, is going to come in with yours, and it might make a different smell depending on the combination of bacteria. In fact, there was really interesting study where they looked at the bacteria of female lovers, and they noticed that the longer they were together, the closer their bacterial milieu became. So they ended up having similar bacteria in their vaginas when they were female and female lovers.
That's interesting. It's like period cycling, syncing up.
Do people really sync up, Christine?
I don't know. I was on birth control for a really long time, so
Right.
I was on a schedule.
So I can't remember like where in the book. It's in the book somewhere, guys, but I think it might be in Bloody Vaginas because we're talking about periods and stuff. But oh yeah, wait. Menstrual sequestration, la la la. Oh, I can't find it. But anyway, it's in the book where I've had patients even say, oh, had this roommate and we synced up, la la la. And I go, if you look at the data, and they actually looked at this data because people really didn't have that much to do in the 70s. And they looked at these women in the college dorm and they took like 260 something of them and they followed them. What they found out is that, okay, first of all, you only have a 28-day cycle, right? And you're going to be bleeding for anywhere between 3 and 7 days on average, right? If you have 268 women, there's only so many days, right? So then a lot of those women are going to be bleeding at the same time, whether they're not on their exact first day all the way through. Like, okay, I might be on day 3 when you're on day 1.
This is
right?
true. Makes more sense.
So it's just chance. It's just math. It's nobody syncs.
It's one of those myths. You just dispelled it.
It's a myth. So yeah, read the book.
We have another question. Barbara wants you to address UTIs.
Oh, thank you, Barbara. Let's talk about UTIs. What specifically do you want to know about UTIs other than we shouldn't wear thongs?
Well, we give her a chance to respond. Why don't you talk about that?
Oh, okay. Well, one of the reasons why thongs should be 3-hour underwear is that it goes up your ass, the little string. And I can't stand it. People say it's comfortable, and I'm just like,
so uncomfortable. I don't get it.
And then, you're just like, every time you think that you might be okay with it, it's like, hello, I'm still here in your butt. And so, no. But anyway, the reason that you don't want to wear thongs is because that underwear is right on your butt. It can the little E. coli can get to the perineum, and it can get from the perineum, which is the interface between your butt and your vagina. It can get into your vagina, and from your vagina, it's a one-way ticket to your bladder.
Oh, that makes a lot of sense.
Thongs should be like date underwear, or if you have a event or some kind of thing where you have a dress where you don't want to see the lines and stuff. But other than that, no, not really. Yeah. So did Barbara ever come up with her?
We don't have any additional information. No.
Well, that's one thing to avoid UTIs. Peeing after sex actually has yet to be proven to decrease UTIs, and they've actually looked at that one too. So, if you don't have to pee, you don't have to get up, and you can just snuggle, because it's not going to matter. It's not going to help you not get a UTI. One thing which will give you a UTI is if your lover, if you're having sex with a person with a penis, and they like to do these little circle kind of thing, and then they hit your perineum and get into your vagina, done. You have a UTI. So if you have sex with a person with a penis, make sure they don't miss. And if you're gonna do any kind of anal play, always vagina first, anal second.
On that note, I don't know how to naturally segue from that one. Honeymoon Cystitis.
Yeah, that's what they call it, because you're just having a lot of sex, and most of the time the man misses and he grazes your perineum. That's how you get the UTI.
Gotcha. I had another question and it escaped me. Oh, what about my grandma actually gave me this advice when I was going through my teenage years, but she says that she always told me you should sleep without panties on to air everything out.
I love her.
My Noni, yeah.
No,
If she were here, she would be very embarrassed that I brought her up.
no, she's awesome. Yeah, I talk about 3 basic things in the book: soap, water, and sunshine, or moonshine for that matter. But we kind of talked about soap, plain soap. That's all she needs. Dove, Ivory, whatever, just plain, fragrance-free, something like that. Water, drinking water, of course, primarily. And then just using just plain old, she doesn't need, toilet water or rose water or anything like that. And sunshine, that's what Nomi said. Well, I say moonshine too, because you do want to air her out. It's like she was exactly right. See, there are some people that people know she just needs,
She just needs a little airflow.
you gotta let the air flow. So what's funny is, how men like to man spread?
Yes.
We should actually be woman spreading.
All right. I like that. My auntie didn't allow underwear overnight.
See, exactly. Thank you, Robin. And your mom was the opposite. Oh, that's interesting. And they grew up in the same house?
So confusing.
Oh, okay. There we go. Aha, that's why. Totally different, ways of thinking. Yeah. And Mary doesn't like wearing underwear at night either. Good. Let's leave her be.
I love how the underwear conversation got the chat going.
I know. People in the chat are having a great time with that one. Oh, that's so great. So anything else? I can't think of anything else.
I sit in front of my fan and air dry. Morning, noon.
Oh, you know what? Actually, after I'm out of the shower, because I keep the hair, I do actually kind of walk around a little bit and let myself kind of air out before I put on my underwear, because you don't want to put the underwear on and things are moist, because warm, moist environments can equate to waking up what few little yeast you might actually have in your vagina.
Interesting. So here's kind of a question that follows this a little bit. Bidets are becoming so much more popular here. I know so many people who are getting bidets installed into their toilets.
Mm-hmm.
Is that, I know douching is not okay. That's not something that you should do, but is the bidet, is that better? Is that preferable?
Bidet is supposed to be for your behind primarily. Now they do have some of those bidets they'll clean you off in the front. That's fine. However, do watch the angle of the water, because you don't want the water to spray your butt and your vagina and urethra complex at the same time, because that could basically be spraying the E. coli right in there and actually end up giving you a UTI. So watch out with the bidets. Bidet is primarily for number 2, not for number 1. Put it that way.
Got it. Barbara is asking, can you talk about what you think about clean diets and interstitial cystosis?
Interstitial cystitis. So interstitial cystitis, thanks for mentioning that one. It is a painful bladder syndrome. So it's pain, urgency, frequency, and bother. It's one of those multifactorial diagnoses. And we talk a little bit about, there's on the internet, you'll see something called the low oxalate diet. And there are some studies about certain foods that you do want to avoid. And in my practice, I absolutely talk to my patients about things that we know are bladder irritants, like tomato products, fake sugar. Unfortunately, caffeine is a big one that can really irritate your bladder. Spicy foods and any of super citrusy things like orange juice, grapefruit juice. So I tell my patients, I give them this big list and I go, this is the list of foods to avoid for right now. Add on one thing at a time. If you absolutely love pasta and you have to have your red sauce, try just that and see if that's the thing that makes your bladder annoyed. If it is, then it's on the bad list, it's on the naughty list. So either be really close to a bathroom or avoid it. So yeah, we do know that diet can play such a big role. We talked about through the book, diet can play a role in a lot of these things.
Jacqueline is asking about vaginal rejuvenation for cosmetic purposes only. What are your thoughts?
Ooh, I had to thread the needle on this because I think I talked about in the book, like, who am I to judge? If you want to get boobs in for yourself, or if you want to have what do they call it? BBL, Brazilian butt thing, if you want to have that done, that's not for me to decide. However, I do want my patients to think about the reasons why we choose to do these things. Are we doing this for ourselves, or are we doing it to meet some societal purpose or some kind of objective that we think is some type of ideal? Look, I have very little up here. See? And I went to the place to get the boobs in, and then I started thinking about it. I was like, what am I doing this for? It's $8,000. So I put in the stock market. Now I have more.
Put in the stock.
I did. I really, really did. But if the labia are really, really hanging and it's really, really annoying you and it tears with sex, or you're getting chronic yeast infections, yes, for purely cosmetic purposes, I do them. But I screen my patients very, very carefully, and because I want to know why. If you come and I know you've already had 4 or 5 plastic surgeries, that makes me wonder, what are your reasons behind doing this? And I've turned some patients down, or I told them that, actually, I don't think you need the surgery. You look perfectly fine. And in the book, I don't know where it is. It's actually in Rejuvenated Vaginas. There's a whole chapter. And we have the Great Wall of Vagina. So if you look on page 187, there was a British guy, British, who made all these plaster casts of vaginas. No two were alike. And what we found is that asymmetry of labia is more normal than symmetry. And like I said, it's all ugly. We sit on it.
We sit on it.
What am I doing right now? What are you doing?
Sitting on it.
Exactly.
Speaking of sitting on it, Barbara asked, what about exercise with spinning and biking? Can it irritate your vagina?
Yes, it can. And so when you're done with your Peloton, make sure to take off the thing that you're on and the underwear and everything that you're wearing, because that can irritate your vagina. If you're sitting on that teeny weeny thing very long, I had a patient who got this terrible inflammatory reaction from being a spin instructor. She had to quit.
Wow.
Her vulva swelled to twice the size that it was. And we couldn't figure out what it was other than the spin. So we gave her some steroids, and, we changed her diet, of course, but it was the spin. So she stopped teaching spin, it went down. Yeah, that was a weird one.
That's crazy.
That was a weird one to me too.
Any other questions? You guys can pop them in the chat and we can answer.
And don't forget, you get 10% off if you're buying the book from Barbara's. Absolutely. Shop local, guys. Don't use Amazon.
All right.
No other questions? Well, great.
I think that's good. That's good. We had, does the clitoris impact it? Is the clitoris
impacted by menopause? No. Now, what can happen is, as the vagina, if you are not using your vagina, it can atrophy to a certain extent, but your ability to orgasm is generally not diminished throughout your life. I've had patients, because they are a little bit in menopause, that their hormonal levels are a little bit low. Their libido might not be the same, but they can still have an orgasm.
I know that another concern that a lot of women going through menopause has is the dryness. They, they can't lubricate enough naturally to make it pleasurable.
Oh, that can be true. And I will either talk about there's a couple inserts. One is called Replens. I like that one. Trying to stay as hydrated as you can. I use a silicone-based lube for a lot of those patients because it works incredibly well and it sticks a longer time. So you can't get this at the grocery store. This is not grocery store lube. You have to go to an actual sex shop. There's one up on 5400 North. It's called Early to Bed. It's sex positive, female owned. Walk on in. They have Uber Lube. It's amazing. Because yeah, we do have to make some adjustments, but we make adjustments for all sorts of other things in life as women. And if we can make some small adjustments, then you can still enjoy penetrative sex.
And then we have a question on thoughts on IUD. Ooh, we got a lot of them coming in. Thoughts on IUD. And I recently found out that an IUD is good for 7 years.
Yes, I'm very happy about that because then I don't have to have it swapped out before I make it to menopause. Yeah, so that's true. The Marina IUD is good for up to 7 years. Now, of course, this is, medical advice, but please talk with your own personal practitioner or physician about anything specific. We are just painting the broad strokes here.
And Barbara, can you talk about hormones post-menopause and do you recommend it?
I do recommend it for patients who are having symptoms. So the WHI study, the Women's Health Initiative, looked at women who were kind of sort of already past menopause. They were a little bit older. And that was the issue with the study. We needed to be studying women who are actively going through menopause, those women who were 45 to 55, 57, who are actively having these symptoms. I do recommend it for my patients who are having symptoms. We try to use the lowest dose for maybe we'll try like a year, 6 months, try to wean off, see how you do. Oh, let's do it another 6 months. We just try to take it step by step to see if we can get you over to the other side.
Got it. All right. Give it a second, see if anybody else has any other questions before we call it a night.
Yeah, let's
go enjoy a nice glass of wine.
Yeah, I know, because I'm drinking juice because I'm on camera.
Great conversation. Yeah, I think that this went really well. Thank you for letting me be a part of this.
Oh, you were awesome. Kudos. So again, 10% off, use the code. And thank you, Christine. This was really amazing. And I really, really hope that we learned something. Please pick up the book. It's going to make a really great Christmas gift for anybody you know and love who has a vagina.
Yes. Everybody I know already knows that if they have a vagina, this is their Christmas present from me this year.
Yep.
So.
Oh, my whole family, I'm like, yeah, this is all you're going to get though, right?
All right. And you want to share your social media channels just before we log off?
And okay. And then I'm on Facebook. Just look up Gynecology Institute of Chicago. One C on FB.
All right. Thanks everyone for joining us. And thanks for participating. It was a great conversation.
Happy vagina, everyone.
Happy vagina.
Bye.